Hey guys, this is Dr. Chaffin. I'm a senior instructor here at SI Institute here in Phoenix. We are a training facility for doctors to get trained on dental implant placement. My tip of the day, okay, I'm going to come out with tips of the day, but tip of the day here is restorative training. Here at SI, restorative training is very, very important to our students. And I'm going to kind of tell you a little bit about why and what separates us from other different facilities. Restorative dentistry in general, my background is I've done over 452 revision cases in my career. Stopped doing revision cases about 3 years ago. Every once in a while I'll do a few, but I have an extensive background in prosthodontics and reconstruction. And it's taught me a lot. And every case I learn. And if you're not willing to learn, you're not willing to grow. And our students need to know, you can go anywhere and get implant placements. But having restorative concepts to dictate where you're going to place implants is really important and knowledgeable. So restorative training that I see is you have cases that are simple, you have cases that are full arch, you have cases that are full mouth with no vertical opening, you have cases that are full mouth reconstruction with vertical opening. So forget the implants for just a second. That itself is complex. Now add a full mouth reconstruction with crowns and bridges and vertical opening with implants. That's complex. How does it need to be done? What's the correct way to do these procedures? So my advice to my students is kind of separate it out and start learning restorative dentistry and get educated. And what I'm concerned about, why I speak very openly about this, is we did an SI survey with 250 doctors over the course of this year. And what was disturbing is that when I asked a simple question is, who refers to a prosthodontist? Less than 5% of all the students I've talked to this year, and the survey was only 250, refer to a prosthodontist. Now, I want you to take a step back into dental school. Remember in dental school when you learned root canals? You did all these root canals, and when you get to a root canal on 14 or 15, it could have more canals than you wanted to, and so what did you do? Refer to a specialist. And dentists really haven't stopped that boundary. Retreatments. Do you guys do retreatments? Some do, that have gone on and got some more training, but most people with retreatments for GPs will go, oh, it's a retreatment, I'm sending an endodontist. But for some reason in prosthodontics, which is the advanced world of dentistry, general dentists in general across the country have stopped referring pros, but have not continued to learn those procedures to dictate the quality of dentistry that patients should receive. You know, prosthodontists, they know how to reconstruct. There's a certain way they do things. There's a certain way they design things. And what I see is general dentists making cases easy, pulling teeth that should be reconstructed, maybe not being educated on it. So my advice to general dentists is to get more restorative training to advance your dental practice. So I'm going to go over this case real quick. This is a simple case. This is your communication. This is actually a real case, but this patient has 12 units to do. And with these 12 units, 3 of these are going to be, well actually 4 of these are going to be based on implants. So you need to extract 2 teeth, place 2 implants, a space here, do an implant, and this particular patient needs crown work. So my question is, how are you going to do it? Some doctors would go, well, I'll do these implants first, and then I'll come back and I'll do the fronts, and then I'll do the backs. Some guys will go, I'll do the crown work, and then I'll refer to my specialist for the implants. Some that are implant trained will do, in different ways. Now, what is my suggestion? My suggestion is to take a step back, breathe, build the architecture, smile design, foundation of the entire mouth. Take some impressions, capture the bite transfers. What is that? A lot of GPs I see won't do the case appropriately because they're afraid of losing vertical dimension. And this is what I talk about SI at the Institute here, is set up your cases. In my opinion, every general dentist should be able to do this case at one shot. Design, prep, seat. Design the case, get all the things you need, sedate the patient, do all the preps, place the implants, temporize in gorgeous temporaries, hold the case, and then after 8 weeks, seat the case. You don't compromise the bite, you don't compromise the value of the patient, or even the aesthetic components. So let's take a step back here. At the Institute, we deal with patients with teeth that need implants, like the case I just showed you. And then we deal with patients that are losing all their teeth that need implants. And in this category here, people that are losing all their teeth, we go over the Fab 3, dentures, hybrids, and bridges. how to set those cases up. So I think in general, what I convey to you guys is let's either start referring to a prosthodontist, okay? And as you can see here, 5% refer. Now, out of those 5% that do refer, another 95, that category, we did another survey. 95% of those people have no extra training. So what is going to happen if we don't do anything about it? Quality of care is going to go down. General dentists, I believe you guys can do more than you're doing. I really push all my students to do more restorative training. And I reach out to you to say there's a lot of institutes that do focus on restorative training that are awesome, that you can combine with implant training. Here at the Institute, we will give you a really nice basic setup on restorative training, setting up cases, designing them, as well as the absolute awesome implant course that we have to teach you how to place implants with confidence, skill, and ease. Anyway, thanks for listening. I appreciate it. Have a wonderful holiday.